Уже все это пролетели. Все. Спасибо.
Спасибо. Dear student, excuse me for technical problems. We will continue our lecture. We stop on the methods of physiotherapy which use for patients maxillofacial region inflammatory disease. Then use also ultrasound therapy, electrophototherapy, ultraviolet laser therapy, vacuum therapy, hydrotherapy, massage, heat and cold therapy, magnetic therapy, oxygen therapy. Electrotherapy uses the electrical energy in medical treatment. In the medicine, the term electrotherapy can apply to the variety of treatments, including the use of electrical devices such as deep brain stimulators, neurological disease, but for stomatologists, dentists, this is also used very widely. The therapeutic effects of electrotherapy include relaxation of muscle spasm, preventions and retardation of disease atrophy, increase of local blood circulation, muscle rehabilitation, reeducation, electromuscle stimulation, maintaining and increasing range of motion, management of chronic and interoperable pain. Contraindication for electrotherapy. It's medical implants or stimulators like a cardiac pacemaker, certain cardiovascular disease, arrhythmias, difference, women who are pregnant, deep vein thrombosis, cognitive impairment. Ultrasound therapy. Ultrasound uses high-frequency sound waves. Sound energy causes molecules in the tissue to vibrate, thus production heat and micromassage the tissues. Ultrasound indication, it's post-acute soft tissue trauma, bursitis, tendonitis, fasciitis, acute injury, inflammation, over areas with a limited vascularity of sensation. Cryotherapy. Physiological effect, it's decreasing in blood flow, vasoconstriction, decrease in muscle spasm, decrease swelling, decrease in pain perception. To maximize effect should be used with rice. Cryotherapy indication, swelling and inflammation present, acute soft tissue injuries. Contraindication, it's allergical, circulatory disturbance, Reynolds phenomenon, prolonged application, our superficial nerves longer than 30 minutes, adverse effects. Physiotherapy is used in all forms and stages of inflammatory disease. Some of the physical treatments are executed at the beginning of the treatment and reinforce the effect obtained after therapy, removal of dental plaque, close curettage of gingival pockets, scaling, surgical decision of removing of purulent after these very widely use physiotherapy. A distinctive feature of physiotherapy is the gradual, profound effect on the tissues that provides long-term positive results. Phototherapy consists of exposure with daily or some equivalent forms of light as treatment for skin disease, infection disease, inflammatory disease. For this use ultraviolet or the infrared radiations. How about contraindication for phototherapy? Ectoderma pigmentosa, breastfeeding, dysplastic nervous syndrome, systemic lupus erythematosus, dermatomyositis, Bloom syndrome, Cockayne syndrome also. In the acute phase of inflammation, porcelain prescribes infralaser methods which soften the gum while having an analgesic and sedative effect. Infrared rays improve local blood circulation and thus accelerate the process of tissue regeneration. Microwave therapy, which is based in non-thermal intensity of electromagnetic waves, is used for the rapid removal of inflammation. AHV therapy has a strong bactericidal effect and reduces the swelling of tissue and stimulates the regeneration of tissue. Infrared laser is an equally effective method prescribed in the treatment of acute gingivitis, while electrophoresis of calcium chloride, vitamins, ascorbic acid is particularly effective in the chronic phase of the condition. Electrophoresis is a low-current electrical drug administration method through the skin and mucous membranes of the oral cavity. It is particularly effective in the rapid administration of antibiotics, vitamins, and enzymes into the bloodstream and lymph system. In the chronic stage of inflammatory disease, porcelain recommends 2 to 3 sessions of physical therapy annually spread across to 5 visits to the dentist. For the treatment of periodontitis in its chronic course, porcelain uses dersonalization, which is a form of electrophoresis with vitamin C and P. This is as a high-frequency procedure which alternates between high voltage and low power current. This method contributes to the regulations of metabolic process, normalizes the excitation process, and removes the feeling of pain. Electrophoresis of calcium chloride and sodium fluoride and dersonalization are also used in the treatment of periodontitis. Physiotherapy treatment have minimum side effects, are easy to use, and often really of variety of nature factors. How about physio rehabilitation for abscess phlegmon in the early stage, in the before formation purulent changes? Appoint local tissue hyperthermia in combination with ultraviolet radiation, starting with 4 biodoses and increasing by the 2 biodoses each subsequent irradiation, and bridging up to 8 to 10 biodoses. The course of treatment 4 to 5 exposures. In the stage of severe inflammation, edema, it's 7 days. Use combination microwave for 5-7 minutes with an intensity of 1 to 3 watt with limited inflammatory process. UHV electric field if the process of spied. They act as a thermic dose if there is hope to stop the process, or in an oligothermal dose if the process goes through all stages. Electrophoresis of antibiotics, for example oxytetracycline, terramycin, for 20 minutes to reduce the virulence of microflora. Fluctuation recommended to prescribe in the early stage of the disease to limit the focus of inflammations. The first form of current for 10 minutes with average dose. you can see variants of ultraviolet therapy. You can see the contraindication and indication. Cryotherapy indications: it's swelling, inflammation process, acute soft tissue injuries. Contraindication you can see on the slide. Rehabilitation measures in the complex therapy of inflammatory disease of the maxillofacial region. Rehabilitation measures begin immediately after the treatment of the disease. Delay is throughout these rapid secondary deformations, the formations of bad habits and parafunctions, the release of feeling of various complexes. The terms of rehabilitation of patients after recovery are determined by the degree of functional, anatomical, and aesthetic disorders and the age of patient. Also very widely in the complex therapy and rehabilitation, patients with inflammatory disease of the maxillofacial region use medical physical culture. MPC in the complex therapy is the main factors in the prevention and treatment of jaw contractures, dysfunction of the tongue, soft palate, and facial muscles. Various means of physical therapy contribute to the restoration of coordination movements of the muscles that perform the acts of swallowing, chewing, and speech. The main task of medical physical culture is the treatment of inflammatory disease of the maxillofacial region. First, it's prevention of respiratory, circulatory, and metabolic disorders. Improvement of blood and lymph circulation in the affected area in order to stimulate regeneration process. Preservation of the function of mimic and chewing muscles of the unaffected half of the face. Improvement of the psycho-emotional sphere, improve mood, patience, prevention of depression, restoration of the patient ability to work. Medical physical culture is prescribed for various lesions of the maxillofacial region and the absence of contraindications in the combination with other therapeutic measures from the first days of the disease or injuries. Indications for the appointment of medical physical culture. Myogenic, inflammatory, cicatricial, neurogenic, arthrogenic, inflammatory, cicatric, neurogenic, paralytic, inflammatory process in the initial stage and in the stage of remissions in soft tissue, cervical, oral, infraorbital region, the area of mortificatory muscles, and temporomandibular joint. Postoperative period for interventions on soft and bone tissue. Plastic surgery using local tissue with replacement of defects with a free graft or the help of the filatal stem after operation. Contraindication to the appointment of medical physical culture. It's general serious condition of the patient. It is intoxication, increased temperature reactions, body temperature above 37.5 degrees of Celsius. The presence of an acute inflammatory process in the area of damaged tissue with purulent inflammation. Increased pain during physical activity. Danger of secondary bleeding due to presence of a foreign body near the neurovascular bundle of after surgery in the vessels. Presence of purulent processes. The period after the applications of delayed suture or after application the internal organs. Periods of the course of the disease and rehabilitation of lesions of the maxillofacial region. Physiotherapy exercises are prescribed after surgical treatment of the focus of inflammation, reduction of pain syndrome, and improvement on the general condition of the patient, which occurs usually first-second days after surgery. Subfebrile body temperature and a moderate increase in erythrocyte rate sedimentation, which observed in some patients, are not contraindications to the employment of exercise therapy. Period of the course of the disease and rehabilitation lesion in the maxillary region. The methodology of exercise therapy is based on periods that reflect the clinical, the patient conditions, and the dynamics of the healing process of the postoperative wound. Periods of the course with abscess and phlegmon on the anterior wall of the upper jaw. It's phlegmon infraorbital region, phlegmon of the zygomatic region, the function of mimic facial muscles. In the absence of phenomena of phlebitis of the facial veins, after the productions of incision, exercise therapy can be started on the second, third day after operation. With phlegmon and abscesses in the floor of the mouth, tongue, of the chin area, and some mandibular triangle, there is a dysfunction of the muscles that lower the lower jaw, as well as the tongue. Exercise therapy is prescribed depending on the clinical course, usually the second, third day after emptying the abscess. With putrefactive necrotic phlegmon of the floor of the mouth, Ludwig angina, therapeutical physical exercise can be prescribed only after cleaning the wound from necrotic tissue and removal of all phenomena of intoxication. It's approximately on the 9th, 10th day after surgical intervention. With peristaltitis of the jaws, with the involvement of group of mastificatory muscles in the process, there is a pronounced inflammatory contracture of the jaws. Early use of exercise therapy in the general complex of therapeutic measures, surgical and pharmacological, is of great preventive importance. The use of exercise therapy methods for peristaltitis is indicated in the early periods of treatment, second, third days after operation, which allows not only to reduce the duration of treatment, but also to restore chewing function in a short time. Osteomyelitis. In the acute stage of osteomyelitis, exercise therapy is prescribed after a decrease in the body temperature of the patient to normal levels, locally after removal of the drainage from the postoperative wound and active granulations of the wound. In chronic osteomyelitis, in the acute stage, exercise therapy is performed after sequestrectomy, after reduction of pain in the postoperative wound, first day after the operation. The early employment of exercise therapy is explained by the fact that the existing osteomyelitis cavity chronic limits the spread of the purine process. There are three periods on the course of the disease and rehabilitation of lesion of the maxillofacial region. The first period of the course of the disease and rehabilitation of lesion of the maxillofacial region is the period of acute manifestations of the pathological process. It is characterized by the development of inflammatory or reactive inflammatory process in damaged tissues or significant intoxication. During this period, it is recommended to carry out exercise for muscles that are not associated with damaged tissue and breathing exercise. Apply those movements of a general nature and local for unaffected muscles and directly affecting the affected tissue. Also, if was operation for treatment, inflammation disease, it's the first period, early postoperative, before the removal of postoperative sutures, last 5-7 days. This period is characterized by pronounced inflammatory edema, hyperemia, pain, dysfunction of chewing and facial muscles, swallowing and speech. The condition of postoperative wound is characterized by the development of the hydration phase and the onset of granulation. Task of medical physical culture in the treatment of the inflammatory disease on the maxillofacial region in the first period. Its general tonic effect and improvement of the psycho-emotional state of patient. Strengthening of local blood circulation, improving local blood circulation, promotions of hydration process in the postoperative wound. Prevention of the development of dysfunction of mimic and masticatory muscles, the formation of contracture of the temporomandibular joint. Prevention of disorders associated with the limitation of the patient's motor activity. Motor mode movements regime, it's bed ward regime. In the first, second, third days after surgery, bed rest. The patient is recommended drainage position, lie on the side of the incision, which improves nature outflow of fluid from the postoperative wound and reduce swelling of soft tissue faces. Exercise therapy in the first period use special exercise for intact muscles, taking into account the localization inflammatory process. It's mimic, chewing, and tongue muscles. Every exercise repeat 5-6 times in a row every 2 hours. Illustration, you can see some exercise for mimic muscles. General development exercise used very widely for the distal and middle sections of upper and lower limbs. It's small and middle muscles groups at a slow pace. 5-6 repetitions, alternative with breathing exercise. 1 exercise, general development, and 1 breathing exercise. 2 general development exercise, 1 breathing exercise. Durations should be 10 to 20 minutes. With second period of the course of the disease and rehabilitation of lesions of the maxillofacial region. It's another name, late postoperative, after the removal of postoperative steams. Hygiene from the second 6 to 8th day. Characterized by a decrease or disappearance pathological symptoms and an increase the improved general conditions of the patient. In the wound inflammation layer of granulation tissue. This period involves an increase in motor activity and patient widespread use of special exercise. In other names, the second period is subacute. It's characterized by a decrease or disappearance of inflammatory phenomena and an improvement in the general condition of patients. In this period, provide fight against the development of contracture, the restoration of mobility of the temporomandibular joints, as well as the function of various muscle groups. Movements regime, the rank mode, is free. The patient is recommended to walk in the fresh air, but should avoid cooling. Patients perform exercise for facial and mastificatory muscles without restrictions, with a maximum range of motion. Mechanotherapy is used. Physical exercise in the forms of provided in the form of morning hygienic gymnastic, therapeutic exercise, dosed walking. In the absence of urine discharge, massage is prescribed also. General development exercise in the second period, full 6-8 repetition for each exercise. Ratio with breathing exercise should be 3 to 1. Duration of exercise session should be 30-40 minutes, 1-2 times per day. In the illustration you can see some example of general development exercise. It's other variant which we can recommend patients. Special exercise in this period, including exercise for the muscles involved in the pathological process. It's facial, chewing, tongue. Repeat each exercise 10 to 15 times in a row, at least 5 times a day. To control the effectiveness of special exercise, it is necessary to determine the degree of mouth opening daily. You can see some variant of special exercise which provide patient in the second period medical rehabilitation. It's recommended to carry out the following special exercise. Again, the background of general development and respiratory. Active free, active with help of the low jaw with the maximum possible range of motion. Use also massage with the tongue on the damaged mucous membrane and the oral cavity itself in the order reduce the formation of scars. Active movements of the facial muscles and massage of the skin in order to prevent scarring. Active movements with the help and use of rubber plugs, wedges, active movements for the temporomandibular joint. Exercise for the tongue and in case of damage to restore normal speech function. The classes use exercise outside the oral cavity and the pronunciation of vowels, syllables, words. After the tongue has achieved good mobility, one should proceed to the pronunciation of letters and words. In the future, reading aloud and in a sing-song voice is recommended. The third period recovery, is characterized restorations of the function of the maxillofacial apparatus. It corresponds to the end of scarring or epithelializations in soft tissue injuries. The task of exercise therapy is to restore the impaired functions of the affected organs and the patient's ability to work. The third period were static dysfunction of the maxillofacial region. It corresponds to the full course of the inflammatory process. The main task of classes during the period is the complete restoration of dysfunction, the adaptation of patient to the household and production loads. Usually the third period of physiotherapy exercise is carried out on an outpatient basis or at home. Patient performs special exercise without restrictions and repeat them many times throughout the day. Physical exercise with weights and resistance with the help of fingers, rubber stoppers, etc. are widely used for a more intense effect on the tissues of the maxillofacial region. The use of mechanotherapy, massage, and physiotherapy procedure is shown in this period very widely. On this picture you can see illustrations, some special exercise for patients with during medical rehabilitation third period. Motor mode movement regime, it's sparing training depending on the functional state of the energy providing system of the body of patient. Physical exercise in the form used in the form of medical hygienic morning hygienic gymnastic, therapeutic exercise, dosed walking, mechanotherapy. Special for all muscles, including exercise for chewing muscles, which perform with resistance by the hand of the patient's or physiotherapist. In this period, use general development exercise with maximum amplitude at an average and fast pace. The number of repetitions is 8 to 12 times. The ratio with breathing exercise 4 to 1. Duration 30 to 45 minutes, 1 to 2 times per day. This picture you can see using of massage. Massage used very widely in this period for improve blood circulation, lymph circulation in the damaged muscles, for stimulate process of regeneration and prevention of scaries. Also, massage stimulate muscle activity, and have good cosmetology effect. In the picture you can see the methodic of massage which can use, and the line for providing massage manipulation on the face. It should be noted that patients with inflammatory disease in the maxillofacial region need complex treatment. Prescribes physiotherapy procedures in the period, also it's ultraviolet radiation, general local, infrared radiation, ultrasound therapy, electrophoresis with anesthetic antibiotics, local tissue hypothermia in the combination ultraviolet radiation, paraffin therapy, local desensibilization, laser therapy by scanning technique. Thank you for attention. Goodbye, good luck.
то есть можно зайти вот так, якщо вот это вот. Ну,